Good morning slash good afternoon, depending on where you are in the world. My name is İrem Sengel Orgut. I'm an associate professor of supply chain management at Loyola University, Chicago, and I am the senior vice president of meetings for women in ORMS Forum of Informs. So on behalf of Worms, I'd like to welcome you to everyone to our first summer webinar for this year. Thank you for joining us today. The title of our webinar is Research with Impact, Women Solving Real Problems. And we are thrilled to have two esteemed scholars with us who will be sharing their impactful research and discussing how OR and MS can be used to address important real-world challenges. Before I turn the floor over to our speakers, I'd like to quickly read their bios. Our two speakers are Dr. Laura Albert and Dr. Marie-Ève Rancourt. I'll start with Dr. Laura Albert. Laura A. Albert is the Senior Associate Dean for Faculty Affairs and Development in the College of Engineering and the Professor of Industrial and Systems Engineering at the University of Wisconsin-Madison. She served as the president of the Institute for Operations Research and Management Sciences, INFORMS, in 2023, and she spearheaded the founding of Industrial and Systems Engineering Day, celebrated annually on September 14th. She is a fellow of INFORMS and the American Association for the Advancement of Science, AAAS, and the Institute of Industrial and Systems Engineers, IASC. Her work has been recognized with the INFORMS Impact Prize, a National Science Foundation Career Award, and the Fulbright Award. She authors the engineering blogs, Punk Rock Operations Research, and Badger Bracketology. If you're not familiar with her blogs, I certainly recommend that you check them out. They're wonderful. All right, and our second speaker today is Dr. Marie-Ève Rancourt. Marie-Ève Rancourt is a professor of logistics and operations management at HEC Montreal, where she received her PhD in operations research. She holds the Canada Research Chair in Humanitarian Supply Chain Analytics. Her research interests include humanitarian logistics, supply chain design, and transportation management, with a focus on using data science and optimization methodologies to support data-driven decision-making and policy. Her recent work uses operations research models to address logistics challenges in relief operations, food security, and healthcare delivery, particularly in developing country contexts. She has collaborated with organizations such as the World Food Programme, the World Bank, Red Cross societies, and the Quebec food banks across several countries, including Kenya, Uganda, Ethiopia, Haiti, Venezuela, Nepal, and Canada. Her work has been recognized with awards such as the AACSB Innovations That Inspire Challenge and the Course Practice Prize, and has contributed to prize-winning articles, including those recognized by the SEIO BBVA Foundation Prize and the PALMS HOCM Best Paper Award. She has published in leading journals, including Operations Research, Production, Operations Management, and Transportation Science. Professor Rancourt has also served in various roles with IVADO, CIRRELT, and the PALMS College of Humanitarian Operations and Crisis Management, and the INFORMS International Activities Committee, and the INFORMS Public Sector OR section. Before I turn the floor over to our speakers, for our audience, please feel free to type in your questions on the Q&A box. And at the end of each talk, we will have a few minutes to answer the questions. And we will start with Dr. Laura Albert. Dr. Albert, you can share your screen and you can start when you're ready.
Happy to do so. All right, so you should be able to see my screen at this point.
Yes, we can see it.
Great. Before I get started, I first want to thank the organizers of this webinar series. I think this is fantastic to bring us all together in the summer, and it takes effort, and I really appreciate that. I'm going to talk today about some of my work in public safety and specifically as it intersects with the opioid crisis. I'm going to highlight one paper and then I will kind of introduce, just have a teaser of a second paper near the end of my presentation today. And today's theme, women solving problems. The co-authors on both of these papers are women. The main paper I'm going to talk about, my co-author is Veronica White, who's a former student and now an assistant professor at the FAMU FSU College of Engineering, and also a WORMS member. So get to know Veronica if you don't know her already. And my talk today is going to be about, public safety and the opioid crisis. So I have worked in public safety, done research in this space for decades, mostly in emergency medical services and fire. And a lot of it has to do with optimizing response times. And then, time goes on. I move forward in my career, students graduate, and then I'm like, oh, I get to start a new research project. This is great. And so I kind of took a step back with public safety and I said, what is the biggest challenge that public safety faces? And it was really the opioid crisis. So a few years ago, we saw the opioid crisis was well underway, I should say. And on this chart, you see the death rate as a function of years. And it's been going on for a couple of decades in the United States, starting with prescription opioids and then illicit opioids that are natural, such as heroin. And then starting around 2013, we see this big increase in synthetic opioids. So this is mostly um, well, it's all sorts of synthetic opioids, and they are really cheap to produce. So there's a huge supply, and they're usually 50 to 150 times more potent than natural opioids. Okay, so this is what's really fueling the overdose deaths. And it's not only the deaths that's linked with a lot of low-level crimes, and I'd seen data that like 1 in 12 calls to police has is something to do with the opioid crisis. So it has this massive societal cost. And, the deaths are just the tip of the iceberg and they're incredibly costly, but so are um, just misuse, hospitalizations, these repeat low-level crimes that have um, a lot of costs in terms of criminal justice. So this is really the problem we wanted to address. And I'm not going to single-handedly solve it. It really takes a community and many of us. And so we started looking at where are the points where people can make a difference. And this involves public safety, such as emergency medical services and law enforcement, but also a lot of other people, including individuals. But also we want to leverage community services and hospitals and healthcare providers. But what's useful about public safety is that they're called first responders. And that's an advantage here, is that they have the opportunity to intervene potentially very early. And we want to leverage this opportunity for social good. Now, a lot of the OR research in public safety not having to do with the opioid crisis, and there's a lot of research in that space, and we've made a huge difference. A lot of that research has to do with optimizing response times, which isn't really the right angle for the opioid crisis. First of all, I want to say that operations research has a potential to really make a difference. In the opioid crisis, it's not like you do one or two policies and then, oh, they're going to reverse the opioid crisis. It requires a lot of layers. And the different policies are in three buckets: demand reduction, so reducing demand for opioids; supply reduction, so like maybe interdicting the illicit supply of opioids. And then the third is harm reduction. So not necessarily affecting supply or demand, but making use less harmful and deadly. And when I think about where operations research can make a difference, I've highlighted some of these in green here, and you'll see it covers all three of these buckets. So we really have a broad scope of impact, and this is actually a strength of our field. Now, the work I'm going to talk about today with public safety is going to be part of demand reduction and specifically going to focus on treatment, which has emerged as one of the best practices to reversing the opioid crisis. And there's essentially three types of policies we're going to focus on with treatment: hospital diversion, arrest diversion, and case management. And I'll talk about those three. Two of the three really have to do with the criminal justice system and policing in particular. Okay, so I'm going to start with hospital diversion. So hospital diversion is when somebody's had an overdose, they're in the hospital. This is a moment where they might say, now's the time to start treatment. And if there are extra resources and social services and medical providers that provide some encouragement, but also resources, and then maybe they make appointments, they can really use that opportunity to route somebody to treatment. Now, building on that is arrest diversion. And so this is where my research really started, is arrest diversion. This may or may not be involved in an overdose. Usually it's not. It's a low-level crime. And if somebody's eligible, like they haven't been convicted of a felony before, what the police have the opportunity to do in my community is to route that individual to treatment. And what's the incentive? The incentive is if they go to treatment and complete it, the charges are completely dropped as if they never existed. So this is a very powerful incentive, maybe more so than hospital diversion. And then the third is case management. So the majority of individuals in prison in the United States have a substance use disorder. And when they, re-enter society, this is a time where they're really susceptible to use and also overdose because they don't have any, they haven't been using for a while. And so they're really susceptible to overdose. Then this is a time where like proactively routing them to treatment could make a difference. So we're going to study the impact of these three policies. And we're going to do so with discrete event simulation to evaluate the policies and see what their benefit to society would be. Now, if we think about the overall like cycle, criminal justice cycle, we're going to see that overdose diversion would be like on level 0. So maybe even before somebody's had interaction with the criminal justice system. The arrest diversion is quite early. So we would call this like level 1, which is that initial arrest or interaction with law enforcement. And case management would be at the very end of the cycle. And I'm not going to get into all the details of the discrete event simulation model. I'll have this nice picture here, and I'll send you to the paper to read it in more detail. So we do this discrete event simulation model, and I want you to keep an eye on this in treatment box in the bottom right corner. Okay, so this is the baseline model, and some people, of course, will enter treatment in the absence of these three policies. So there's some baseline treatment. Now, if we look at overdose diversion, there's already a path to treatment, and we're going to strengthen that pathway. And the other two policies are going to add new pathways to treatment. So arrest diversion adds a new pathway, and then case management also adds a new pathway. And ultimately, we want to implement all of these policies, we don't have to choose among them, we can do them all. And if we look at all of them, one thing to keep an eye on here is that we're routing a lot more individuals to treatment. So we want to keep an eye on the treatment capacity as we do our simulation, because that's something you can plan for. And we'd want to know what that capacity would need to be. We built our simulation model based on our county in Wisconsin, Dane County, Wisconsin. And a big reason for that is because the arrest diversion policy has been approved by the district attorney in our county. And we had a lot of contacts, and we're able to use public data sources and really ground it in kind of what's happening here locally. So all of our data we used was public, based on public data sources and clinical studies. And there were a couple of parameters where we relied on expert opinion. We ran the simulation for 20 years with us, which was essentially 5-year warm up and then 15 years of the simulation. We did a lot of testing and calibration for the model. I will say for here that the arrest diversion was actually implemented starting, I believe, in 2017. So that was part of the calibration and validation process. This is really detailed in several appendices in our paper, so I'm just going to summarize this really briefly here. And I want to highlight our results. Okay, so we looked at the result of the different policies and different strengths. I'm just going to show you total cumulative costs right now. So we want costs to be low. So in the absence of these policies, we have a baseline cost, total cost. And some people might go into treatment over time just in this baseline policy. What we also show here is the policies on their own. So just one policy at a time, arrest diversion here. And what you'll see here with the stair stepping is different strengths of arrest diversion, where the arrest diversion is able to divert more and more individuals, and that leads to decreasing costs. Now, maybe not, at the far end of this, the far right-hand side, maybe that's not super realistic, but we get a sense for the range of potential impact. And we can look at and study the other two policies as well, just on their own. So we have arrest diversion and then case management. Now, as I mentioned before, we're really interested in these three policies together. And so what's of most interest is these joint policies on the right. And this leftmost green policy that the arrow is pointing to right now is actually very moderate or conservative impact of these policies. And we can see that even for a relatively small county like Dane County, it reduces the total cost by around $211 million, which is a lot. That's just costs. And we also can look and report similar results for arrests, hospital encounters, use, and deaths. And these are all positive impacts of these policies. If I want to take a step back and highlight some of the insights from the model, one is that we noted that treatment usage is going to increase over time, even in the baseline. And that's because overall usage had been increasing in this time frame, and more individuals will just go to treatment on their own. Now, we do see an even greater increase in treatment usage with our policies because we're routing more individuals to treatment. But it wasn't a massive increase. At no point did treatment demands even double, for example. So a community can plan for that. We also found that the policies were largely complementary and they didn't really cancel each other out. And that's kind of obvious if you go back to that curve and you look at that continuum of the journey through the criminal justice system, is they work on different time frames in that continuum. In terms of the policies, I don't really have a favorite, but arrest diversion does reduce costs the most because it reduces costs for usage and death, et cetera, but it also helps reduce the massive downstream costs in the criminal justice system. So it prevents all of those costs from even being incurred. So that's a benefit. In terms of all the health-related benefits, overdose diversion had the largest reductions, and that's deaths, use, hospitals, encounters. These are also really big in terms of societal cost. And to be honest, overdose diversion is the cheapest to implement, and it can give us the greatest bang for our buck. So that's a positive as well. I still have some other work going on in this area. I just want to have like one or two slides on a separate paper having to do with supply reduction. Veronica was also involved in this paper. The main author is a student of mine, Monica Rico, and she did a really nice job with this paper. And what we wanted to study here was locating prescription drug collection boxes. And they exist all over the place. And I've put some unused prescriptions in my local collection box, and they really do make a difference. I was a little skeptical at first, but the most common way to start opioid use is through somebody else's prescription drugs. And so now it's very common to if you have surgery and they prescribe some opioids, they give you some information about how to dispose any unused drugs safely. And people actually use them. So we have a drug take back day in the United States. It's now 2 days a year, and you can dispose throughout the year as well. However, historically, they've been located at law enforcement sites, which presents a barrier for many to use them. And these would fall in the supply reduction bucket. Although most of my research has to do with demand reduction, I have done some supply reduction. And I'm going to show you the existing infrastructure in Wisconsin. So we have 505 boxes that were located in an ad hoc manner, not strategically using operations research. And we'd have what we'd call deserts. So these are areas in our state of Wisconsin that you see in red, if you go on the left graph, that there's not a nearby box within 5 miles. And so distance to the box is actually one of the greatest factors to determine if somebody's going to use a box. Now, there's only 164 boxes not at law enforcement sites. So if you think about that as being a barrier for many, that takes us to this rightmost figure here, which has a lot more red on it. And there's a lot more deserts when you look at distance to the closest drop box, not at a law enforcement site. And so we wrote a paper on how to strategically locate collection boxes, and it essentially shows that this ad hoc placement, of course, many people are underserved and they don't have a nearby box. And if we were strategic upfront, that would allow us to really make a difference and maybe prevent a lot of usage. But I will point you to the paper. It's been published in Optimization and Engineering, and I'll have a link to that at the end. So with this, I want to wrap up my part of today's webinar and definitely make the case that there are some real problems out there, and sometimes they're messy and they're complex, but we're really good as a community in addressing problems that are really important to society. So overall, in this stream of research, I've showed you about discrete event simulation today. Some of our work uses queuing theory and causal inference, and the locating collection boxes uses integer programming. Okay. And we need to consider all of these different approaches across the three buckets: demand reduction, supply reduction, and harm reduction. And what we can do really makes a difference. We can understand the different trade-offs, and hopefully we can influence policy. So with that, I want to thank you for your attention. And on this slide, I have some information about both of the papers that I've mentioned today.
Thank you so much, Dr. Albert. Very interesting and very relevant work. I do not see any questions from the audience. So if anyone from the audience has any questions, you may put it in. Um, in the meantime, I do have one question.
Okay.
So you mentioned several interventions, including the overdose diversion, arrest diversion, and the case management. What I was thinking about was, were there any findings that surprised your practitioner collaborators, where when you showed them, they didn't expect to see that, or it wasn't, it challenged their way of thinking?
That's a good question. They really were interested in the causal inference work because when we started with working with, and we had the medical doctor overseeing this program as well as this wonderful team of police, they could see some of the associations were good, but it was really when we did the causal inference that said, does being routed and completing that treatment, does that seem to really make a difference in terms of follow-up arrests? They were really pleasantly surprised that we could say with some confidence that it went beyond just correlations.
Yes.
But it was kind of, I don't say that it was massively challenging to anybody, but it was, I think we were definitely, it's always nice to see that you have evidence that a program seems to be working and making a difference. And the more you can highlight that, the better. And they need that ammunition, so to speak, to get follow-up funding, and so also to encourage other communities to come with. So that was nice to be part of that.
Absolutely. Yeah, I agree. Um, okay, there is one question. Um, okay, couple of questions. Um, so the question is, thank you for the interesting work. A couple of questions. One, I believe in the percent in the results, uh, percent in the results that were intervened and effectiveness was added to it. Is that correct? If so, is it indicating the effectiveness of each intervention is moderate? Do we know what are the major barriers to this low effectiveness?
Yeah, so there's a lot going on there. So we looked at the percentage as like the percentage of individuals that would essentially follow up and complete the treatment. So there's a couple things going on in that. And that's why we don't believe those numbers would be 100%. But we do have a pretty good baseline for the arrest diversion that's realistic. And then if you look at the paper, the baseline hospital diversion was 22%. So that's about 1 in 5 individuals would follow up with treatment after a hospital overdose. And so we worked with some experts to come up with numbers uh, that might be more realistic. But they're also getting better at what they're doing, and we've seen this over time as you pilot a project. That first year impact isn't where it's going to be. That's like the lowest level it's ever going to be, and then they figure out how to do their job better. But that's a good question.
Mhm. Are there any other, I don't see any other questions or any follow-up questions. Okay,
Can I
right.
ask you a very academic question?
Sure.
So there's multiple things. I was wondering for the publication process, for example, as you said, while you do the project, at the end of the project, maybe sometimes what you should have done or with working with them, what could have done been better for, the follow-up. But then, you also have to publish what you have done. So it's just how you keep the balance between uh, trying to have a good publication, but also publish what you have done, and not you cannot wait all the time to have the perfect thing. And then sometimes
Yeah.
when you do a follow-up project, and often it's unfortunate, but when you do an applied project, if you have used the data once, then it's as if it's over, because the second time they will always ask you how you position yourself with what you have done better and stuff, and it's as if you have less contribution, although it's kind of better and you add on to it, but sometimes the reviewer don't see it that way. So I was wondering how you balance with publication, uh, with all the difficulties that goes with it when you do applied work, because sometimes the methodology is not like that complicated, but there's a lot of work and data gathering, problem understanding and stuff. So how do you balance out all these challenges, let's say? Maybe you don't have them. I don't know.
Yes, I think we have these challenges. I think I'm probably used to them at this point.
Mhm.
It's always good to think about having a few ideas with papers and then trying to get a publication soon. And so um, we did that in this case. So I will say that my co-author on the causal inference paper, who was the expert, was an assistant professor at the time in that, and we felt some pressure to move forward. And then some people that were collaborators on the medical team wanted us to wait on certain things, but that was some and we ended up moving forward as much as we could with the data. We could have done a follow-up paper, but I think we would have run into some of the issues, as you mentioned. It would have been too similar. It would have been hard. Um, so it's a little bit of a give and take, but for me, it was easier in this instance because I was protective of a colleague who needed that paper for tenure. So I was happy to push forward with that. And it was actually with students, they also need those publications going forward. So I'm always trying to find like wins for them as well. Um, yeah, but it can be, yes, there are many challenges and and they can be somewhat unique to some of the projects too.
Mm, thank you.
Great. Thank you so much, Dr. Albert, for your talk and your insights. And we will switch over to our second speaker, and Dr. Marie-Ève Rancourt. You can share your screen and start when you're ready.
Do you see it's the first slide, right? Is
Yes,
that
yes,
okay? Yeah, because I have two screens. I was wondering if you were seeing notes or stuff. Okay.
yeah.
So thank you everybody for attending this webinar. So today what I'll do is that I'll dig more in depth into one project that I've done with some co-author, all women, as you can see, which is often the case for a reason I cannot really explain, but it seems that I enjoy working with women. So this project is mainly one of my PhD student projects. So Birgé has done most of the work. So I'm very proud of her, and I've supervised her with Bourgeot-Balzics from Oswego University and Valérie Bélanger, also from HAC Montreal. But before I present the project, because Irem asked us to a bit present what we are doing, so I'll just go briefly to explain how I work, to give you an idea of the type of projects that I'm working on and how is my approach so that I come up with the project before I dig into this example. So usually it's always start with a conversation with a partner. So it could be WFP or it could be, you know, a local NGO. And then it's through a conversation where, you know, I try with my students and other co-supervisor understand what do they do. So we have a first discussion trying to understand what do they do, and it's through asking them questions so that we can try to find the right places where we can support them with our expertise. So that means that every time I start a project, I never know where it will go because it will depend on the need of the partner because it's written, so what I do, it's bottom-up data-driven research. So that means that sometimes I'm gonna work on project related to transportation management. Sometimes it's really inventory analysis. It could be supply chain design. And the problem will require different methodology, depending on the project. So sometimes it could be simulation, sometimes it could be optimization, sometimes it's just econometrics, sometimes it's also data analysis. And at one point, if I feel that the methodology that is the best suited for the specific problem, if I feel that I don't have the expertise to be able to do it properly, so sometimes I ask somebody else to jump in to make sure that, it's going to be done properly. And one thing that is very important throughout the process is like the validation mechanism with the partner, because it's sometimes surprising that, you understand something in one way and then you present something and it's not exactly what was needed or how they find it. And sometimes even it's when you show them the results that they're going to tell you that the results doesn't make sense because it cannot be done this way. So having known a priori, you would have known that there was a constraint out there, but they don't necessarily verbalize it, or they're not fully aware of it because their brain doesn't work as our brain. And it's very important throughout the process to always be open, trying to find the right words to explain what we want to do and try to translate what they are saying. So it's quite a challenge in that sense. So that's why, you always have to validate throughout the process what you're doing. So I've been working for the last, I don't know how many years, too many years, more than 10, I believe, for data-driven optimization, especially in humanitarian supply chains. So I believe that humanitarian supply chains are very interesting and unique characteristic and challenges that give rise to complex data-driven optimization model problems that are very fun to scope and tackles and try to come up with a nice insight with them. So one thing that I think it's also very important to make sure that what you do in this context is valuable. It's very important to try to understand in which context those supply chains are deployed. So really trying to understand what is the specific service that is provided and what is the scope of distribution of this service. Who are the stakeholders involved? And stakeholders are not always large international humanitarian organizations like UN agencies or like RFRC, but sometimes it's local communities, local government agencies. Sometimes it's also like small NGOs, and all of these players has an important role to play, and it's important to understand how, these decision maker, what power they has as to take decision and which information they have, so that you well describe the problem and on which level of the supply chain are you looking at. Is it last mile? Is it higher level? So it's important to be able to explain all these components and at which time is your problem is positioned in terms of the disaster management cycle. So is it preparedness? Is it a decision that has to be taken prior to disaster? Is it something that is taken after the disaster? Is it recovery? So putting all this information in place is very important so that you will present your story for the problem that you are addressing. So throughout the years, I just took some of the example of partner I had and some of the type of service that I've been looking at. So I've done a lot of work in food aid. So my first project were done with WFP in Ethiopia and Kenya, and Haiti, Venezuela. So for different services like a school feeding program, general food distributions, trying to understand transportation markets in developing countries that are quite complex. I also work with a local food bank. It's like for 10 years, like with students trying to solve small problems so that they can offer better services. I also work for healthcare, like for organizations that were serving community health worker in Liberia with Last Mile Health, mobile clinic routing with Première Urgence International in Iraq. I've done a lot of work in prepositioning, so for relief item with the Humanitarian Response Depot of the UN, CDMA in the Caribbean, and lately working for evacuation planning in Haiti with the World Bank, trying to find the right places for shelter, and now for fire evacuation and also fire resource management. And I've also worked with project with the Red Cross for accessing clean water and sanitation. So I've done different stuff. So one particular project I want to present today is a case application of ESUPS in Madagascar. So just to put you in context for this project, so we did this project with this state of mind, imagine yourself as being the chief logistics of the Red Cross in Madagascar. There's a cyclone coming that is expected to landfall in 5 days. So what do? You have 6 warehouses where there's stock prepositioned there. So what do? You wait. So either you wait and see what's going to be the impact, and then you're going to move your stock so that you're going to answer to the need. Are you trying a priori? You have 5 days and trying to anticipate what's going to be the impact so that you move your stock in the warehouse so that there are better places when it's going to be the time to deploy them. So what I'm referring to as now is called anticipatory action, which means acting ahead of predicted hazardous events to prevent or reduce acute humanitarian impacts before they fully unfold. So those type of action, of course, can only be deployed or designed for predicted hazards like hurricanes or cyclones or forest fires, for example, but it's not necessarily the action that you can do for an earthquake because it's not possible to predict an earthquake. So anticipatory action, are gaining a lot of attention in the humanitarian sectors as of today. So there's different agencies that try to define what are the right frameworks, what should be the right action, how it should be done, but there's still a lot of question remaining. And there's certainly a huge gap in data-driven decision support tools to support those actions. So what is agreed by most all organizations is that a proper framework for AA should combine three components. So first, being able to have a tool that's going to predict the impact. Second, design tools going to be able to support decisions, operational decisions, and tools as well that's going to say when it's the right time to act. So there's a many, let's say, models out there that's gonna try to predict different risk or do prediction, and there's many optimization models that's gonna, make recommendation on how to route items or where to locate them. There's few models that gonna integrate all these components. So for this project, because AA can be done for different logistics decisions. So here we look at what we are referring to as repositioning. So one strategy that is quite classic or deployed in the humanitarian sector is what we are referring to as prepositioning. So it's a preparedness action. So it's the placement of relief items in very strategic location, so that when the disaster hits, so that you can respond, so distribute them depending on where they are located. But when we refer to as repositioning is that you have a network where you do prepositioning, but you have early warning of a disaster coming. So what you aim to do is repositioning them in the network. So it's not preparedness, it's not response, it's a bit in between. So this project has been made in collaboration with the Emergency Supply Prepositioning Strategy, so ESUPS. So ESUPS is an international initiative that aims to support humanitarian organization in relief items prepositioning and also try to improve and support them into better coordination, because coordination is one of the important challenges in the humanitarian sector. So ESUP doesn't hold stock, doesn't have stock. So what they offer is a service to support organizations that do prepositioning. And one of their important services is the Stockholm Digital Online Platform. So if the Stockholm platform is deployed in a country, so all the organizations that has warehouses or that are operating in this country is going to map on this platform what is the level of inventory they have in their different warehouses of different items. The platforms also provide data-driven recommendation based on historical data at the beginning, let's say, of a season where, there seems to be a lack of stock or too much stock, depending on what had happened. And more recently, it has been extended to support anticipatory repositioning based on forecasts, and this is where we fall. So this is the project we have done with them. So the goal of this study is to develop an integrated data-driven AA framework to support repositioning decision and implement it into the Stockholm platform for real-time use. So the case study, so the context or the pilot project for that is Madagascar. So Madagascar is prone to several disasters every year. So the most important one being cyclone, but also Madagascar is prone to acute malnutrition or malaria or all different issues. But here we were going to look at cyclone because this is the most important disaster. And of course, Madagascar is a already vulnerable region because it's the fourth poorest country in the world, so they lack of the local capacity or the resilience to be able to support the need when a disaster hit. So there's already 10 organizations that has stock preposition in different places in the country because there's 10 organizations that are currently deploying different programs in Madagascar. So there's 41 warehouses. Some belong to the different ministry, agency, so from the local government, but there's also international organizations such as UNICEF, Save the Children, CARE, and so on. So what I'll do for the rest of the presentation basically is to go through the different steps of the frameworks to explain to you what we have done and how we have designed it to be able to support ETSUS in this context. So for the first, impact prediction. So one thing that was very important to us to be able to, design a tool that would, if you have a forecast coming of a cyclone forming, what's going to be the need in the country. So the idea was not necessarily to make sure that we have all the possible data, more precise data, because we also wanted to make sure that the approach was scalable in other contexts in other countries. And, data scarcity in the humanitarian sector is an important challenge. So what we try to rely on is data that we were kind of sure that would be available if we would want to scale that approach to any country. So first, what we use is wind speed. So wind speed that come from the hurricane, depending on the region in the world. If it's in the Caribbean, it's going to be called an hurricane. But if it's, in the South Pacific, it's a cyclone, but that's the same meteorological phenomenon. So wind speed is the basic, that you has from the hurricane track when it has hit the country. Population density, so it combines, the amount of people, but also how they are spread throughout a geographic area. So again, this information is usually available in any country. And we also use the relative wealth index. So for most of the country, like Google have deployed one, the World Bank is also having different indexes so that we know that those index would be available in other places. So we did linear regression. We have tested like hundreds of models. The idea again was to come up with the simplest model that was effective. And we came up with a model that has a R-square of 50%, and we were quite happy with that. So with this, we have a prediction model. The thing is that when there's a forecast coming in real time, you don't have a point estimate for the wind speed, but you have a range. Let's say if you're in the green zone, so that means that the wind speed is going to be between, 50 kilometers an hour up to 80 kilometers an hour. If it's a rain zone, that's a different range. If it's orange, different range. Yellow, different range. So what we have used is that, okay, we have our prediction model, and then we have a track. So what we do is that we generate random wind speed depending on the place. If it's which region, is it green, is it yellow? So then you draw a random number following a uniform distribution within this interval. And we then implement the forecast model, and we did that 150 times. So for each region, so that would allow us to design demand scenarios to inject into an optimization model. So the second part is planning decisions. So for that, we have implemented the two-stage stochastic optimization model, where the first stage decision is depending on where the stock is prepositioned, then you want to move them in the system. So it's the inventory relocation between warehouses. You want to make sure that you finish your operation prior to landfall. And for the second stage decision, depending on where the stock is, what is the demand? Because at that point, the demand is revealed in the second stage, then you deployed. And one assumption that has been done for fair distribution and that has been agreed with the partners is that let's suppose that the demand is the demand is higher than the stock you have, so then you distribute it proportionally to the demand. And then the objective is to minimize expected response time, because this was the most important objective. And then the secondary objective is to do that so that you minimize the travel time for reallocation. So this is the model. And then as third part, you need to decide when to act. So what is happening is that there's forecast coming. So you can either decide to act now, reposition your stock, or to wait until the next forecast so that the information may improve However, what's going on is that the more you wait, the roads are deteriorating because of the damage from pre-cyclone rainfall. So this is the trade-off then. Should you act now so that you make sure that the road conditions are better and you're gonna have the time to finish your operation prior to landfall, or you wait until the next forecast hoping that the information will be better? So in order to do that, to say when you act, so what we have implemented is a dynamic optimal stopping problem. So what you do, you have a forecast, so then you predict the demand. And then you solve the optimization model, assuming that you take the decision now. And you solve the model, assuming you take the decision the next forecast. So if acting now would worsen the performance, in this case would worsen the response time, so then you act. If not, you wait until the next forecast. So to test this approach, so what we have used is one case study of Cyclone Batsirai, which was of course not included in our test set for designing the prediction model, because that would be unfair. So Cyclone Batsirai hit February 5th in 2022. It was quite a devastating event that has caused important damage with many people that has been impacted. So for this, for like cyclone, so we had 5 valuable forecasts that has been proposed by, that have been designed by the ADAM tool of WFP. So that's why for data, what we had 5 forecasts. And then for the real demand, so we have extracted information coming from different reports and so on, so that we can have the amount of relief item needed in different regions. And then for the warehouse location, so what, and the different organization and to who they belong. So we have used the information coming from the ESUPS platform. However, we didn't know what was the inventory level in 2022. So we have done different assumptions. So depending if, the amount of inventory is equal exactly to the demand, half of the demand, or 1.5 times the demand, so that we're gonna test different settings. And then for the road, the travel time. So this was the difficult piece, because there's no precise model out there that's going to tell you, when they're going to expect that amount of rainfall, how the driving speed's going to reduce in a dirt road in these places, So what we have done in order to design proper speed reduction models, depending on the amount of rainfall and depending on the road conditions. So we have read several reports, the academic literature, so that we could extract different possibilities on how the speed will reduce over time and what shape it's going to take. And for that, we have designed like small reduction of speed, big reduction of speed, if the speed reduce exponentially or linearly. And again, we have test different settings. So then to see the effectiveness of our approach, so what we wanted first to test is it good to implement dynamic trigger based on an optimal stopping framework that's going to say when to stop? Then is it good to do repositioning? Is it better to wait and see? Or there's an advantage of reallocating your stock prior to landfall? And then we also wanted to assess the benefit of collaboration. So I think I have very few time left, so I'm going to go very quick. So when you implement the optimal stopping framework in this case, so the algorithm suggests to act at forecast 3. And we have tests, because organization, usually what they do is to wait and see. And if they do anticipatory action, they're going to decide a priori you act at forecast 1 or you act at forecast 3. So we have tests, how our approach compare when you fix the time at which you're going to act. So what we see is that, as I said, here we act at forecast 3. So usually for that case, and then this result is probably not generalizable, but what we can observe is that if you decide to design fixed triggered, then it's better to act earlier than later. Then that would be interesting to see if we should extend this result. But this result is probably generalizable, is that the dynamic trigger is much more beneficial when the speed or the road will damage more. And then, of course, what we have observed is when you compare with the wait and see policy, anticipatory action is quite good. So across different instances, so we reduce the response time on average by 43%, which is quite significant. And when it has more benefits, it's when you have less stock than the demand. Because of course, if you have a lot of stock, even if you take bad decision, the stock will cover for your bad decision. But at the moment that you have not much stock available, that's where anticipatory action is more beneficial. And the last test we have conducted is, the value of collaboration here. As a base case, we have assumed that the 10 organizations, they share the warehouse and they act together. So if we take decisions, supposing that they don't share warehouses and they only act with their warehouse, or if they take decision only based with their stock level and their information, as opposed to acting together, so we see that collaboration reduces response time by 44% and can also reduce the travel time significantly. So with that, we hope that it's going to allow our foster organization to collaborate, because with these insights and with this tool, that allow them to do it in a simpler manner. So to finish is that I think with this study, we have contribute interestingly to propose an integrated framework for anticipatory action. And we show that it's beneficial and that collaboration also improve decision making. And it's currently integrated into the Ipsos online platform just to see how it look like. So this is one example where you see when is it to ask what's going to be the demand in different region. And here you see what's going to be the recommendation, how the stock should be moved in the system. So on this, thank you.
Thank you so much, Dr. Rancourt. It's very, very interesting. And it's also great to see that it was implemented.
It's currently implemented. It's impressive.
Okay, so we do have one question from the audience. Thank you for the interesting work. I believe building sustainable collaborations takes significant time to build trust and to understand each other's work. How do you approach this? What are the best practices from your experience?
So that I cannot answer. It's difficult to answer this question because, of course, we cannot force the partnering organization, UNICEF, Ministry of Health, to collaborate and act together. Again, as you said, you need trust, you need to build trust. So what we believe is that we've designed a tool that allows for transparency and visibility. So that's the basic that you need, so at least that you know what the other organization has. And then the tool, I guess, would also, I didn't show it, but there's incentive, the tool will show incentive of collaboration. So how it will allow them to benefit if they don't, if they do, and then to accept or reject the recommendation. So we hope that this tool that facilitate decision-making together, that allow for visibility and that allow to systematically tell them what is the right thing to do, the best way to do, and then they can reject or accept. That would be one path towards facilitating coordination. Now, that I hope we'll be able to conduct an experiment or a case study of further how this will be effective for, collaboration. If this will allow more collaboration or not doing interviews, but we'll see how it goes. But that's an interesting thing that should be done in the future.
Thank you so much. I believe it's especially interesting to see, hopefully for them, that if the 10 organizations collaborate together, the response time reduction is so much better. That is probably a very interesting insight. But Okay, so thank you so much. We would like to thank both of our speakers, Dr. Laura Albert and Dr. Marie-Ève Rancourt, for joining, for presenting their insightful research. I'd also like to thank my fellow WORMS board members for their help and support in putting together this webinar. So for the audience, everyone, if you're not a WORMS member, and would like to become one, we really would appreciate your support. You can become a WORMS member while you are renewing your Informs membership, or separately from that as well through the Informs website. And the last thing I want to mention is that the recording of this webinar will be made available on the WORMS channels. Sorry. So thank you so much. I wish everyone has a great summer, have great rest of your week. And thank you so much.